Hello, in this video I'll be talking about cervical cancer screening among homeless women. Cervical cancer is the fourth most frequently diagnosed cancer among women, totaling to approximately 604,000 diagnoses globally and 13,900 diagnoses in the US. 70% of cervical cancers occur following a sexually transmitted infection known as human papillomavirus. Incidence and mortality rates for cervical cancer have declined by almost 50% thanks to advances in early screening and treatment. Given this, regular pap smear tests are considered essential for every woman's basic healthcare. Unfortunately for some, access to screening comes as a challenge. The homeless population, affecting 3.5 million Americans per year, is no exception. Many women who are homeless face unique barriers and risks that discourage them from seeking their beloved pap smear. Barriers include high level of mental illness and poor access to primary care, unwelcoming experiences and stigma in healthcare settings, absent or inconsistent health insurance. Homeless are a mobile population, so it makes it difficult for health systems to provide feedback or arrange follow-ups. Homeless women have an increased risk of cervical cancer compared to the normal population for such reasons being childhood sexual abuse, unprotected sex, multiple partners, alcohol, smoking, and substance abuse. So we know homeless women have limited opportunities to complete their recommended screening, but it is still unclear. Are homeless women up to date to their screening despite challenge? What are attitudes and practices do homeless women have regarding the pap test? How many homeless women are users of contraception or STI prevention methods? And what are the results of the pap test among homeless women? In attempts to answer these questions, a New York-based study went on a hunt for homeless women who fit these characteristics. 21 to 65 years old, resided in New York City shelters, English or Spanish speaking, able to consent and answer questions, have not undergone previous hysterectomy with cervix removal, have not had prior diagnosis of cervical cancer, which required a different screening schedule. After thorough selection, 297 homeless women of 21 to 65 years were picked, all who have stayed at 6 major New York City shelters from 2012 to 2014. In a 30-minute face-to-face survey with a trained female research assistant, relevant information from the women were recorded, such as age, ethnicity, education, homelessness duration, marital status, sexual orientation, contraception methods, and smoking history. Each participant was required to answer questions and self-report as an assessment of pap smear literacy, perspective, and practices, as well as record their last pap smear test results. The main findings of this study showed 76% of women were up to date with their pap smear, 65% did not know their results and assumed that it was normal, and 8% had abnormal results. This study emphasizes the need for effective cervical cancer screening among the homeless population, especially since many are naive about their pap smear results, neglect follow-up appointments, and have poor cervical cancer literacy. Limitations include missing potential participants, exclusion of non-English and non-Spanish speakers, subjectivity to bias, over-reports and unreliability, potential missing relevant data, and insufficient information about health barriers. We can address the barriers homeless women face by making the most of shelter-based clinics for women. By employing patient navigators and peer educators who have undergone systematic and targeted training specific to the homeless, they'll have a good understanding of the barriers homeless people face, offer unbiased cancer counselling, help build patient cervical cancer knowledge, educate the importance of pap smears, address patient misconceptions, and remind patients to stay on top of their cancer screening.